This is a study looking at cortical gray matter volumes in relation to long COVID. Currently, we're looking for ways to identify long COVID with brain MRIs, and we don't have obvious targets for long COVID at this time. So these brain MRIs are often failing to diagnose long COVID. So in the study, they're looking at 24 individuals that have long COVID with neurologic symptoms, where they looked at these patients at a median time of 85 days following a lab confirmation. So that would be a PCR test, with the results of the study showing a significant depletion in cortical gray matter, which is likely influencing the long-term neurological symptoms that impair these long COVID patients, impacting their quality of life and their productivity. And then if you're vaccinated, this gives a slightly lower risk of long COVID, but you can still die and still contract long COVID with multiple infections, and the vaccine won't make long COVID any worse than if you weren't vaccinated. So to restate, your risk is lowered with a vaccine, but this won't stop you getting long COVID. And then the patients in the study were between 22 and 60 years of age, with 79% of them being female. They had no prior record of neurologic impairments or cognitive decline or chronic fatigue. And the top 4 neurologic complaints were brain fog, fatigue, new onset headaches, and trouble finding words or speech impairments. The brain volumes of the patients in the study were compared to the NeuroQuant normative database provided by Cortex Labs, with cortical gray matter being significantly lower than healthy controls, and then the hippocampus and thalamus being larger than for the healthy controls for age and sex-matched individuals, with depletion of that cortical gray matter volume likely contributing to the neurologic symptoms of brain fog, which is defined, at least in this paper, as a reduction in alertness or mental acuity, or the impaired ability to concentrate, confusion, or clouding of consciousness.